Our paper that was in the December issue of Thorax describes a program that we began together with the Ministry of Health of Ethiopia to initiate and to scale up treatment for drug-resistant or multi-drug-resistant MDR tuberculosis TB in the country of Ethiopia. We began our approach based on work that we had done in Cambodia, where similarly working with the Ministry of Health of that country, we initiated and scaled up the country's MDR TB program. And the paper describes the first 612 patients who completed at least 2 years of treatment. So we have 2-year outcome data on the 612 patients. Up until this month, we've initiated about 1,400 patients in the country. And what we achieved with the 612 patient analysis is we're reporting the highest outcomes of success for treatment outcomes in multi-drug-resistant tuberculosis so far reported in sub-Saharan Africa. And we are coming up with a combined treatment success rate of about 79%. In HIV-negative patients, we are reporting 81% cure and completion, and in HIV-positive patients, approximately 69.5% cure and completion. We had a very, very ill cohort. 5.2% had presented with core pulmonale or right-sided heart failure. The average number, the median number of previous treatments was 2 to 3. Most patients had cavitary disease and bilateral pulmonary disease. The other very salient problem that this group had was nutrition deficiency. Our median BMI was 16.6 in this cohort, and both BMI and HIV co-infection was associated with a poor outcome. One of the features of the program that that contributed to the high success rates was the fact that we had only about 5% default from treatment. And that, I think, can partially be attributed to the very intensive focus on side effect management or adverse drug effect management, as well as a multi-layered approach that involved community-based approaches and hospital-based approaches, including home visits of the patients, supplementary food, and very vigorous monitoring of side effects, as I mentioned. In terms of other adherence strategies, we developed approaches that included a patient supporter, usually within the family, home visits on a monthly basis. If patients had problems getting to the hospital for their monthly check there, we provided transportation assistance. As well, we started about 15% of the patients on a outpatient basis. So this experience really raises the bar of expectations in Africa, in sub-Saharan Africa. Up until now, the average positive outcome is reported around 55%. And of course, this means that 45% fail therapy and go on to either extensively drug-resistant TB with a very ominous prognosis, or they die. So even though, the fact that we could achieve this 80% in this population, which was very ill, had a significant HIV co-infection rate, and was in a very resource-challenged environment, shows that it can be done. But still, we haven't done enough, because 80% is not 100%. And this is a curable illness, even in the setting of HIV, when it's treated promptly. And it underscores the necessity of getting drugs and programs to people, that there are approaches that are tractable and that work, and this is one of them.